Hello, everyone, and welcome to the Strength and Hormones podcast. Today, I'm joined with Dr. Mae Hughes. We are going to be talking about how to prevent diastasis recti, safe movement for pregnancy, and really everything you need to know about pelvic floor health during conception and pregnancy. So, thank you so much, Dr. Mae, for being here. I'm so excited for our
Mm.
conversation, and welcome.
Thank you so much for having me. I'm really excited. I feel like I could talk about this topic for days and days and days.
Well, why don't you just give us a brief intro into yourself before we get into today's topics?
Yes, so for those who don't know who I am, which is probably most of y'all, you just call me May, but Dr. Mae Hughes, I'm a pelvic floor physical therapist based in Nashville, Tennessee, but I work with thousands of women across the globe through online programming. It really kind of just sparked from the need for more accessible programming to pelvic health, especially during pregnancy and postpartum. You can only work with so many people in person, and so that's why I started to kind of take on education through the various social media platforms. And I love getting to just work with women every single day, whether it's one-on-one in person or just chatting on the internet.
Yeah, and I know that you are also pregnant yourself, right? So this is probably kind
Oh
of a
yeah.
topic that's near and dear to your heart too, personally, right?
Yes, I always forget that, right? I go into all the professional stuff, but I'm a mom of one, and I have a sweet little daughter who's about two, a little over two, and then I'm currently pregnant myself with baby boy. So everything that I'm discussing, I'm going through myself, been through it before, going through it a second time. Um, and so I know firsthand just how important it is to work on your pelvic health during pregnancy.
Yeah. No, and I think this will be a really great topic. I know a lot of my audience had questions on it, and I'm also pregnant, and this is my first pregnancy, and I've been, active my whole life, and working out is a really big part of my life. And honestly, like once you get pregnant, I feel like it's very overwhelming, where you're just like so afraid that like, are you going to do too much? Are you going to hurt yourself? Like, you're going to hurt the baby? There's just so much kind of like fear that is around it, and it's like that maybe working out is good for you, but what type of working out is best for you, what's the right amount, and things of that sort. So I'm really excited to talk about that. But why don't we just first start off by touching on diastasis recti. I want to talk a little bit about what it is and if this is something that is normal, something that's preventable.
Yes, love this topic and probably one of my most frequently addressed topics with patients in person. So, kind of briefly, a little core anatomy, just really quick. Otherwise, diastasis doesn't always make sense. But pretty much, you have one of your abdominal muscles called your rectus abdominis. It's your big six pack, eight pack muscle. And you have two sides of it, two halves. It's connected through a thin piece of tissue called your linea alba. Think of it as just connective tissue. It connects both halves of the muscle. And so with diastasis, that is when you get a stretching of that linea alba that connects the two halves. And so when it's stretched, it becomes thinner. Now, that doesn't necessarily mean that you're going to have pathology with that thinning of the tissue. But diastasis, that term truly just refers to the thinning of the tissue. I like to avoid saying separation because at least from like a medical perspective, when you say separation, that actually indicates like a hernia. So you truly like actually sliced through the fascial tissue, or you've had some sort of damage to the fascial tissue that is physically separated the fascia. So it's more of like a thinning of that linea alba versus like a hernia is actually when there's a true physical separation that needs to be surgically repaired, if that makes sense.
Yeah, absolutely. Okay. And I know you talk quite a bit about this being something that is like a normal part of the process of like growing a baby. Is that correct?
Yes. So by about 36 weeks of pregnancy, research shows that nearly 100% of women have some form of thinning or stretching of their linea alba. And another thing that's important to note is that everyone's anatomy is different. So you might be born with an increased, what I call interrectus distance, so IRD, the distance between the two halves of the rectus abdominis. You might have a larger distance from birth compared to someone else. So normal anatomical variations can be anywhere from like 0 to 2 centimeters, studies show. So you might have already had some sort of um, gap, for lack of better terms, prior to pregnancy, but maybe you're only noticing it now because A, you've seen it somewhere on the internet, or B, maybe we'll talk about this kind of later as we go through some of the things to look for with diastasis, but maybe you're starting to notice that your core just doesn't feel quite right, or you're noticing some coning or something along that has kind of really triggered you to start thinking about diastasis. But just want to put it out there that a lot of people have this thinning or increased distance well before they ever get pregnant, and a lot of people have it who've never been pregnant.
And is there anything else besides just the genetics of maybe already having that would put someone at increased risk?
Yes, typically I see this increased inner rectus distance with multiple pregnancies. So if this is your subsequent pregnancy, just because once your tissue is thinned out, it's a lot easier for it to become thinned out a second time, and especially if you didn't have a full like repair or recovery or healing or whatever you want to call it, if the tissue just didn't go back to its prior resting spot between your pregnancies, you're kind of starting at a increased distance going into that pregnancy, so it's only going to stretch more. So yes, definitely, just being pregnant puts you at risk, but then multiple pregnancies will kind of increase that distance. Higher BMI, regardless of pregnancy or not, just because it's more pressure against that linea alba. Usually, those are the things that I see as tried and true risk factors, although once again, research is kind of up in the air about what is a true risk factor.
Sure. Okay. And other than just like the appearance of abdominal separation, is there any other reason why this would pose like harmful for someone where they should be ultra cautious about this occurring?
The reason why a lot of women focus on it more during pregnancy is A, because maybe they're visibly seeing it now, but B, if you don't regain the strength of that connective tissue, that linea alba that connects the two halves, if you don't regain that strength postpartum, it can lead to a whole host of pelvic floor dysfunctions because you're kind of creating damage, for lack of better words, to your core system. So it can impact so many things. Like it can impact incontinence, it can impact pain that you're experiencing in your lower back or in your pelvis. It can um, really anything that's related to pelvic floor dysfunction. Your diastasis might be a contributing factor if you haven't regained that functional strength of the tissue. Now, I will say that just because you have an increased inner rectus distance does not mean that you are dysfunctional. I've worked with plenty of women who have, let's just say, a two-finger gap. So there's that increased distance between the two halves of their rectus, but they're able to engage their deep core correctly, and so they don't have any functional deficits associated with that increased distance. So there's a difference between cosmetic appearance and functional appearance of a diastasis. So that's why I want to really just re-emphasize that everyone kind of has a different inner rectus distance even prior to birth. And so your function and your cosmetic appearance don't always go hand in hand. Like you can have great function, but maybe your tissue, maybe you're just someone who's got increased elasticity of your tissue. Those people who are really hyper flexible. Once their tissue becomes stretched out, it's not going to just always, rebound in the way that someone else who has a genetic makeup of really dense tissue might return. So that also plays a role, just your genetic makeup of how your tissue and your elasticity is made. Um, there's a couple of myths or just things that people don't always consider when they think of in their diastasis. They might think once a gap, always a gap, or once a gap, I'm always going to be dysfunctional, but there's not necessarily always a relationship between your the distance that you have and the function that you have.
I see. Okay. And it sounds like this is treatable, like postpartum, and it's not something that necessarily is always like, going to be there forever once it occurs during pregnancy. Is that correct?
Yes, typically most women, their linea alba tissue, their diastasis will quote unquote heal or return to its prior resting state by about 8 to 12 weeks, given they haven't done anything to further damage or cause further dysfunction of that diastasis. So, what I mean is, if you do the right things and you progress slowly and you engage in your pelvic floor and core rehab, your diastasis will likely come back together and you won't have any long-term deficits. Some people need more rehab than others. Now, ways that you might impede that rehab is returning to high-level core exercises too soon. Think you have overstretched that tissue. And if you load it really heavily with all of the old things that you were doing prior to pregnancy, like sit ups and planks, right away, then you're going to be loading a tissue that doesn't have the capacity to handle that load at, you know, 6 weeks postpartum or whenever you start engaging in them. So that's why it's really important. You don't have to avoid planks and those higher level sit-ups exercise for life. You just want to make sure that you are progressively loading that muscle to get back to that point. So you're doing more of like your trunk stability exercises initially, and you're watching for any signs of improper pressure management against your abdominals, which is typically where coning comes into play.
Okay. And are there any big no-no type movements? I think everyone hears like don't do sit-ups, but I know there's a lot of other things that potentially also put you at risk of diastasis. So is there any like top movements that you're like, those are a big no-no during pregnancy to prevent this?
Yeah, so want to reemphasize you can't necessarily prevent the thinning of your linea alba during pregnancy, but what you can avoid and prevent is an excessive diastasis, right? So one that is more thinned or separated than it needs to be. Um, so typically I have my patients learn what coning looks like. And coning is kind of this pressure against your thinned out linea alba, so that connective tissue in the middle of your rectus. So you apply pressure against it, either by like holding your breath or doing lifting a really heavy weight or something like that. If that tissue is really thinned out, then you're going to see this like triangular appearance in the midline of your belly. So that's usually a cue to just keep in the back of your mind that if you're doing an exercise and you see that coning, then either the load is too heavy for you during pregnancy or postpartum, or you're just not able to properly manage your core pressure anymore to reduce that coning because you don't really want to see that coning. If it happens intermittently, when you get up from sitting or laying down on the sofa, like that is not going to make or break you. But during exercise, coning is really an indication that, hey, whatever movement you're doing is probably a little too much for you, or maybe you've lost that deep core connection. So either take a break, reset, or it's time to modify. So typically by the time you get to the second trimester is when I see a lot more women experience that coning, especially if it's their, second, third, fourth pregnancy. So you start to see that coning a lot earlier. So some of the movements that are common to experience that coning are going to be like your full length planks because that's just a lot of pressure down on the rectus. Pull-ups, people don't always consider that as a core exercise, but it really is. And I see coning occur pretty early on in pregnancy, sometimes even the first trimester. So that's going to be one that you want to modify or eliminate and just work your, upper back and lats and a variety of other exercises. Sit-ups is another one that maybe sometime in the second trimester you start to notice that coning. So maybe you modify by elevating yourself on an incline or just switching to a different core exercise in general. Those are typically the ones that I see people experience the most toning and need to modify. So your planks, your sit-ups, your pull-ups, but there's all good, great modifications for them. So I don't recommend like completely omitting them, but definitely continue to monitor yourself for that coning because that's your biggest clue that hey, this exercise, it might be time to go.
Yeah. It's interesting you say that too, because I noticed that when I was doing pull-ups, there was like a certain point in my first trimester where I was like, ooh, that feels like something's like stretching. Like it just didn't feel right anymore. But people don't really talk about, okay,
Yeah.
pull-ups being like one of those, it's an issue. But I just kind of like felt it intuitively. I was like, I don't think
Mhm.
it's really worth like risking this. I'm just gonna pick like something else, you
Yes.
know?
No, and that's great. That shows that you have like a great connection with your body. So you kind of just already inherently notice that rather than kind of like pushing through it, you've recognized, hey, maybe it's time to switch things up and work the lats and upper back in a different manner. So yeah, pull-ups is one that just kind of gets glossed over sometimes.
Totally. Yeah. And I know that we talked a lot about like things to not do or like to really, watch out for that coning, like you mentioned, which I think is a really great
Mhm.
resource for someone, especially if they have like the ability to, see like a mirror or something while they're doing these exercises. But is there anything that you recommend from
Mhm.
more of a like strengthening or a prevention standpoint that someone should look at adding into their regimen to help with that?
Yes, I would say if you are not strength training prior to pregnancy, now is the time to add it in. I'm not talking about by going out and, immediately starting Olympic weightlifting, but strength training in general is one of the best ways to just improve your overall strength. And what you need is core strength during pregnancy because your muscle has memory and it's going to help with your postpartum recovery and it's going to help with that linea alba coming back to its prior resting state. So the way that you work on your diastasis and work on at least not necessarily prevention strategies, but how can you best support it during pregnancy is by strengthening your abdominal musculature because that connective tissue, that linea alba, connects the two halves of the muscle. And the way that you strengthen connective tissue is through load, just like a tendon. Same thing, like if you were going in to have a total knee replacement. As a physical therapist, we would strengthen all of the muscles surrounding your knee prior to your injury event, not necessarily equating total knee replacement with birth, but you get what I mean. There's trauma to the area. So you want to build up your strength as much as possible. That way, postpartum or post surgery, you haven't lost as much muscle mass and it's a lot easier for your muscles to start to reconnect and be like, oh yeah, hey, I remember how we do this. I remember how we engage. I remember how we activate during exercise. Um, and so a lot of people sometimes eliminate core strengthening during pregnancy because they're fearful or they don't know what to do. And I totally get that. Like it can be terrifying. And without having proper guidance, you might not know what's a good strategy, what's not a good strategy. And so a lot of people just shy away from core strengthening, but I recommend continuing with it. I don't recommend doing it every single day. You don't need to do that. Um, just like any other muscle in the body, you need recovery after you work a muscle group. So I typically work it 1 to 2 times a week. Specifically, it doesn't mean you're not getting in core strength just from, lifting a heavy weight. But targeting, your obliques, your deep transverse abdominis, your rectus, your lower back, your QL muscle, all the muscles that surround not just the front of your abs, but also your entire core canister 360 degrees. Strengthening that core canister during pregnancy is going to be the most helpful for you for healing postpartum. And so that's why I really recommend trying to educate yourself, seek out a pelvic floor therapist, seek out pregnancy, postpartum certified specialists and exercise who can help you with these strategies and take some of that fear away from what do I do? You don't want to just do nothing.
It's a really good point, and I appreciate you mentioning that too. And I think it's a good segue as well into just talking about overall like the benefits of movement during pregnancy because there is a lot of fear mongering around it, right? And I think just fear even from the mom about is this safe for me? Is this like pushing it too much. There's statements about how you shouldn't get your heart rate over, what is it, like 140 beats per minute and things of that sort, or
Yeah.
don't try new exercise and things you've never done before. So, like, what is the truth here? Should women be really focused on movement during this time period? And if so, like, what type of movement should really be the focus?
Yeah, I totally understand you on all of the fear mongering kind of surrounding pregnancy and physical activity. And I think some of it comes from the fact that there's not a lot of research on women and strength training in general. And then you throw pregnancy into the equation, and there's even less because of certain things, right? Like people don't want to conduct studies on pregnant women, that sort of thing. But I think we're pretty much all in agreement at this point that it is okay to strength train and lift weights during pregnancy. If you think about it, your body mass is increasing during pregnancy, especially in your abdominal region. And the way to best support that increased mass is by increasing your muscle. Like you need to lift, your body is heavier, so your muscles need to be stronger to continue lifting your heavier body to reduce pain. Of course, you're going to experience low back pain if your lower back muscles aren't strong enough to support this bowling ball that's growing in front of your belly. So I think that's just something I want to put out there that we're all in agreement at this point. Strength training is good for you and it's encouraged. And it's honestly what I recommend is like your first line of attack for activity during pregnancy, just because of the incredible benefits, of activity, of shortening labor time, of improving like your mood and your energy levels, and so many other things that research does actually support and show exercise is great for you during pregnancy. Um, but there's not really like this set of guidelines of like this is exactly what you should do and what is the most safe and yada yada. But they have, research has started to show that, okay, we don't need to worry about our heart rate as much because your heart rate automatically increases, your resting heart rate automatically increases during pregnancy because you have more blood volume. You have an increase of 50% of your blood volume during pregnancy because you are growing another human. You created a new organ. And so your heart's working harder already from the beginning. So that means when you start just even light walking, sometimes I've, looked at my heart rate just going up the stairs and it's already close to 140 beats per minute. Then you throw in that I'm holding a toddler on one side of my hip and I'm way over 140 beats per minute. And I'm not even technically, working out. Granted, carrying a toddler while being pregnant is definitely a workout, but in the traditional sense of, lifting weights. So I think that we're all starting to move away from the fact that like you got to keep your heart rate down. You can only do light walking or swimming or, low intensity exercise because we're realizing that you need strength to improve your stability of your body because it's changing and it's growing and your body is stretching and growing in all 360 degrees. So you need that strength and stability. Um, I also enjoy running during pregnancy. I think a lot of times people used to say that's a no-no, but they've really shown that running doesn't necessarily increase the impact on your pelvic floor as much as they thought. Um, so it's the same thing as like a single leg activity. So if you were running prior to pregnancy, you want to continue running. If you're not experiencing the common signs and symptoms of pelvic floor dysfunction, like leakage or pelvic pain or heaviness, then why not continue running? I do recommend always strength training as well. Just always gonna put that out there. But why not continue running if it feels good for you and it feels good for your mental health?
Mm-hmm. Absolutely. And you mentioned a couple of just benefits through strength training as it relates to labor. Can you go into a little bit more detail about how strength training throughout pregnancy improves labor and maybe even impacts the baby as well?
Yeah. So just by exercising, not it does, the research doesn't necessarily differentiate, like are you Olympic weightlifting or are you just doing like HIIT boot camp class or something like that? So just like moderate activity shows that your body can better manage stress during labor. Because think about it, during labor, your heart rate likely increases because you're going through a stressful event. And it's kind of like exercising. So you can improve your body's ability to cope during labor by exercising throughout your pregnancy because your body can better, return your heart rate back to like a resting heart rate. It can better cope with contractions that might increase your heart rate. It can also improve your baby's ability to handle all that stress as well because you practiced it through exercise. You've gotten your heart rate up. You've increased the stress, the fight or flight response to your body while exercising, and then you've been able to cool it down at the end of your workout. Always don't skip a cool down. That's important. Um, but it's kind of like replicating the same thing when you are in labor. And then research shows that if you've exercised during pregnancy, you can potentially have a shorter labor, which we are all for. And it can reduce the need for external devices such as like a forceps or a vacuum, and even potentially reduce the need for a cesarean delivery. Now, the reasons behind the exact reason why is kind of hard to determine, but kind of hypotheses are that you are better able to cope physically because that fight or flight response you replicated during pregnancy, during exercise, and so you're able to kind of cope better during labor. But that also your musculature is just more resilient and you can handle the longer duration that is labor. Labor is a very long, potentially long, stressful event. And so if you have stronger muscles, you can likely continue laboring in positions that you like and so on and so forth.
Sure. Okay. And does that statement also stand true for prevention of things like perineal tearing?
Yes, perineal tearing is kind of a tricky topic because once again, there's just not like a ton of evidence on women during pregnancy. I will say that learning how to be able to relax and lengthen your pelvic floor is probably the most beneficial thing that you can do because think about it, during labor, you need to be able to relax your pelvic floor so your uterus can push out your baby. Um, so I do want to caution against like constant pelvic floor tension. Like you're like, okay, I'm gonna make my pelvic floor super strong. I'm just gonna Kegel, Kegel, Kegel all day. That's not necessarily what you want to do. You wouldn't do that for any other muscle in your body. You wouldn't hold a bicep curl all day long. You want to be able to functionally, use your arms. So you want to be able to fully lengthen and contract a muscle. And I think people kind of get focused on just like the contraction part of their pelvic floor and forget that it's a group of muscles that function just like any other muscle in your body. They need to contract and they also need to relax. So learning how to be able to lengthen your pelvic floor is equally as important as strengthening it. So strengthening your pelvic floor helps to support physically the growing weight of your baby and uterus during pregnancy. There's just more pressure down your pelvic floor. But you don't want to forget about the lengthening and relaxation part. So you don't want to hold a Kegel all day necessarily, because you need to be able to relax and lengthen it during labor to help your pelvic floor stretch to hopefully reduce that perineal tearing. I will say perineal tearing occurs in roughly 80 to 90% of first-time vaginal deliveries. Doesn't mean that it's severe. We want to prevent severe perineal tearing, which is grade 3 or 4 when you have a tear that extends, from your vaginal opening all the way to your anal sphincter. With grades 1 and 2, think of it like a paper cut or like a little grazing kind of your vaginal wall or anywhere around the perineum. But really, that those grades 3 and 4, the severe perineal tearing, you are going to decrease that by learning how to lengthen your pelvic floor and relax it, instead of holding an intense contraction all day. So hopefully that didn't kind of confuse people. You need both strength and length of your pelvic floor. You want to work on both during pregnancy. Old advice was kind of do like 5 sets of 20 Kegels every single day of pregnancy, and you'll set yourself up for success. And no one's doing that anymore. At least not current pelvic floor PTs or good ones.
Yeah. Okay. And I think that's a good point because I've heard before that, especially for women that do strength train more consistently and like have a history of it, that you tend to have
Mhm.
like a very tight and like strong pelvic floor, and that they might deal with more issues with like that lengthening and relaxation that's really important in those final days leading up to labor. And so, like you said,
Yeah.
it's really important that you're working on that strengthening, you're doing that strength training throughout pregnancy, but then you also have the ability to switch to kind of like off mode. It's just like our nervous system, right? Like we don't always want to be in fight or flight. There
Yes.
needs to be a rest and digest state as well.
Yes, exactly. And love the way that you put that because that's exactly what I am trying to educate my patients on. Like when you are working out, you are in your fight or flight mode, and that's good. That's normal. It helps you like power through a workout. But at the end of your workout, we need to come back down to that parasympathetic rest and digest because otherwise you're going to hold that tension for the rest of the day, especially in your pelvic floor because you're trying to support the weight of your baby. So you need to be able to switch it off, like you said, kind of relax and lengthen it. And I will say, like, anecdotally, I haven't seen any paper come across this. Maybe I'm wrong and I haven't done enough looking into the research. But anecdotally, just like from patients and friends, those who do strength training really intensely and kind of use that as, well, I'm gonna strength train and be so strong because I'm going to power through labor and it's going to like help me push out my baby faster. And they don't incorporate that mobility and that pelvic floor relaxation and lengthening. I do actually see that this can interfere with their labor, potentially making it longer or harder, or even, like I said, anecdotally, this is not evidence-based, but I do see increased cesarean deliveries sometimes with these like super intense strength training of women who refuse to do any pelvic floor lengthening mobility work, right? You don't want too much of anything. You want to be right in the middle. You don't want to be super duper strong and have no idea how to relax and lengthen, but you also don't want to just be super mushy and then your pelvic floor has a hard time healing postpartum. So you want to be right in the middle, just like any other part of your body.
Mhm. Okay. And do you think that maybe in like the days leading up to labor, it would make sense then to not strength train and like focus more on the lengthening? Or do you think that they both need to be co-occurring in those, and like that final push?
Yeah, I think the classic PT answer is it kind of depends on who you are. If you're someone who has a hard time like relaxing and lengthening your pelvic floor, then you might benefit from just focusing on lower back and pelvic floor and hip mobility those last couple of weeks because you know internally that you already struggle with holding a lot of tension. If you are someone who knows that I have a great ability to shut it on, shut it off, and the strength training that I'm doing hasn't bled over to any sort of like dysfunctions during my pregnancy, so I feel comfortable doing both. I don't necessarily think you need to be hitting PRs the last week of your pregnancy, and hitting your 1 rep max for your squats. I definitely think there should be a taper into your volume and load in your third trimester, but I think in terms of like you completely cut out all stability work the last couple of weeks, it really depends on the type of person that you are in terms of, do you already live in that fight or flight mode? If you do, you might lean toward the side of just a lot of mobility. But if you're someone who's like, no, I got control over this, I can switch it on, switch it off, then okay, you can continue, with your stability and strength work, but make sure you also have that good mobility work in your programming. Um, I personally was able to do both stability work, strength work, and relaxation and lengthening the morning I delivered. I worked out at 4:30 in the morning and I went into labor at 4:30 p.m. that afternoon. Um, the workout, it wasn't super intense, but I felt good using my muscles and, knock on wood, I only had a grade one, a graze of my pelvic floor, and it was a very smooth labor. But I just want you to know, take that internal reflection yourself of the kind of person and the way that you kind of strength train.
And is there any other indicators besides someone, like you said, maybe knowing they're kind of in a fight or flight more of the day or doing a lot of strength training that could indicate that they have overactive or underactive pelvic floor?
Yes, so some common signs and symptoms of just overactive pelvic floor that you might be experiencing during pregnancy are going to be some of your common ones like constipation. Granted, that's also just common during pregnancy in general, but say you are doing all the right things, like you are staying on top of your water and your electrolyte management, but you still have constipation or you still have trouble maybe initiating the flow of urine. And that's a sign that you probably have a tense or overactive pelvic floor and you might need to work on lengthening it and relaxing it. A good thing that I also like to have people do is physically put their hand over their pelvic floor. It can be through their clothing. And see when you inhale, do you feel a little bit of pressure down into your pelvic floor? That's a good thing. That means you are lengthening it and visualize like a trampoline. So you can feel it lengthen. And so now you can take that mental note and be like, okay, yeah, I feel like I'm lengthening my pelvic floor. And then when I exhale, if I actively think about contracting it, there's a difference between that pressure management. If you inhale and you don't feel any sort of pressure, no change in your pelvic floor, then you might be holding a lot of tension. And so you might be someone who needs to really focus on relaxing and working on that pelvic floor length. In terms of underactivity, honestly, I see overactivity just a lot more, especially in pregnant women, and just women in general. But in terms of underactivity during pregnancy, maybe you are experiencing a lot of leakage that's not necessarily even related to like running. Maybe just like when you are coughing or sneezing, if you're not able to lift your pelvic floor up and in quick enough, you might experience a little bit of leakage. Um, and there's always like the potential for pain if your pelvic floor is kind of weak or underactive, then it's not necessarily doing its proper job of helping with stability in your trunk. So maybe you're experiencing some low back or pelvic pain. But I would say 8 times out of 10, the pregnant women that I see when I do internal exams, they probably are a little bit more tense because their pelvic floor is like holding on for dear life to support, trying to support this growing baby. Um, but those are kind of some good things that you can try at home to see, am I underactive or am I overactive?
And you mentioned that it's really important to strength train throughout pregnancy for all the benefits that you mentioned, but that we also need to have like the alternate mode, right? Which is the lengthening and like knowing how to relax. So what does that look like to you in a perfect world? And maybe kind of walk us through like how you integrate that into your programs to have that right balance
Mhm.
between the two.
Yes. So whether you are working with me in person or through one of my online programs, I always start a workout with a warm up and I always end it with a cool down. And in both the warm up and the cool down, we start with breath work. So I always start a workout with breath work. It's a way to tune into your nervous system. It's a way to see, are you holding any tension in your pelvic floor, just even going into the workout? Like a lot of people don't realize this, but they're maybe clenching their glutes or they're squeezing their jaw, and all those things can lead to a tight pelvic floor. So it's a way to kind of just tune in with your breath, feel your diaphragm expand, feel the pelvic floor lengthen. And then when you exhale, just feel it kind of rebound. And then also, depending on, if you're doing upper body or lower body, I incorporate a lot of active mobility drills in the warm ups and cool downs, um, and some lighter stability things because stability also helps with your mobility. If you do endless stretching all day long, um, but you don't strengthen within your new range of motion, your body's just going to go back to where it was. So you want your body to be strong through a full range of motion. So typically, I recommend doing, I don't know, a 4 to 5 minute warm up and a 4 minute cool down. It doesn't need to take up your entire day. But even just taking, 10 breaths at the beginning of your workout to really tune in, see, can you feel your pelvic floor lengthen? Does it rebound? What other areas are tight? Usually your lower back during pregnancy, your hips. Um, you tend to grip them to gain more strength. So just going into a workout with your full range of motion and not holding any tension can make your workout more effective because you're strengthening through that full range of motion. And then on the flip side, at the cool down, we kind of talked about, okay, during your workout, you get into that fight or flight mode, but let's, get back down to rest or digest at the end of your workout with a cool down. Doesn't need to be super long. You'll need just like 30-minute cool down routine. Just, 3 or 4 minutes, check back in with your breath, make sure that, okay, any tension I develop during the workout, I'm going to now relax and let go of it using my breath work, using some active mobility drills. So I think that's kind of the best way to incorporate it, at least from my perspective, and what has worked for me and my patients and online clients. Just really taking that time to do breath work and active mobility both before and after a workout. Some people like to include separate routines, maybe at the end of the day. During the day, you can develop a lot of tension and stress as well. So some people have some nightly cool down routines, which are great, and I recommend as well. And I have some of those in my online programming as well. I know personally, once I hit the third trimester, I started doing those in addition to my daily workouts. I started including just 5 to 10 minutes of, breath work, active mobility of the hips, the trunk, the hamstrings, anything that kind of attaches around the pelvis or trunk. So even like your upper back and your ribs, your intercostal muscles, those can all impact your pelvic floor and your labor and delivery experience. So I started including that separately as well, just before bedtime, kind of after I put my daughter down. Nothing crazy. I think sometimes people think we need to do like hours and hours and hours of body work, but just really taking 5 minutes for yourself at the end of the day can be far more beneficial.
Sure. Okay. So it sounds like a lot of the kind of pelvic floor exercises, if you will, are kind of like built into the movement patterns then, rather than it being like do 10 Kegels and then do your squats, if that makes sense.
Yeah, it's more about integrating. The most important thing you can do for your pelvic floor is learn how to integrate it with your breath, because your diaphragm, which is your breathing muscle, is directly related to your pelvic floor. And so you want both of, in order for your pelvic floor to optimally function, you need your diaphragm optimally functioning. Um, and so kind of integrating and just learning how to activate your your deep core and your core musculature, and learning how to properly breathe using your entire rib cage is probably one of the most beneficial things that you can do for your pelvic floor during pregnancy, and honestly in general, but especially during pregnancy, because your body is changing so much and you kind of lose the normal ability to breathe into your diaphragm. We all have been out of breath during pregnancy, all feel like we can't breathe. So really taking time to actively focus on, can you maintain as much as possible that full diaphragmatic expansion, full rib cage expansion during pregnancy. It's not going to be perfect just due to true postural changes, but how close to normal can you keep that diaphragmatic breath and your trunk and rib cage expansion? Because that's going to be the most beneficial thing for your pelvic floor, rather than just doing isolated Kegels, because you don't ever really do isolated Kegels in life. Your pelvic floor works when it's a postural muscle. When you are doing things, when you're lifting things up off the ground, when you're carrying groceries, when you're getting in and out of your car, it's a postural muscle. So really isolated Kegels aren't necessarily the best thing. There's always going to be a time and place. I'll never say never. There's always going to be a time and place where maybe someone just has a really hard time learning how to connect with their pelvic floor, especially postpartum. Like, things get all jumbled up in your brain, and your mind to muscle connection sometimes goes out the door. So yeah, maybe sometimes early on, like first 1 or 2 appointments, I'm like, okay, I just want you to inhale, and on exhale, contract and lift your pelvic floor up and in, just to kind of like reestablish, okay, that's how I do it. Now let's integrate it into full body strengthening, and more like functional movements. So I don't want to never say never.
Of course, of course. Okay. So I know that you see patients in person and then you also have online programs. If someone's not in Nashville, then they obviously don't have the option to be able to work with you in person, I'm sure. But if someone was, how does like one determine that they can do a program and get what they need out of it versus coming in and seeing you one on one?
Yeah, I mean, it's a great question. Honestly, most of the patients who work with me one-on-one are doing my program as well. And we kind of just do check-in appointments. So maybe we do an initial evaluation. Maybe they just want to know what's the situation with their pelvic floor going into pregnancy, right? Like, am I doing this right? Am I actively contracting? Am I actively relaxing? What are some, I just want to make sure I'm doing things correctly. And then I kind of get them on my movement through pregnancy strength training program because it's a full body program. So we separate upper, lower, full body days and then a pelvic floor and core stability day. And I'm not gonna there's not going to be anyone out there who wants to come into my office 4 times a week to get those 4 workouts in. So it's honestly far more beneficial for them where maybe I see them once a month for an in-person appointment and then they continue with the strength training program. So in an ideal world, if you can find a pelvic floor PT near you and maybe do a couple of appointments during pregnancy to get that like hands-on experience, if they do internal work to be able to like get that active feedback, like am I relaxing? Am I contracting? Am I engaging my deep core correctly? Sometimes that can be so helpful to have that like hands-on feedback, but that doesn't mean that you can't start my movement through pregnancy program. I have a ton of educational modules in the beginning, kind of showing you and cueing you and teaching you, okay, this is what you should feel when you're contracting. This is what you should feel when you're relaxing. I was pregnant when I filmed it, so you can actually see like what my belly is doing. And that's kind of why I created the program, honestly, is so many people don't have access to pelvic floor physical therapists. Not every pelvic floor physical therapist is well trained in strength training during pregnancy. And so something is better than nothing. And so a lot of women go through my program and never work with pelvic floor therapists and still have amazing outcomes. So that's just my two
Awesome.
cents.
Yeah. Okay. So that's your movement through pregnancy program. And then is there any other programs that our
Mhm.
listeners should know about?
Yeah, so then naturally I have an early postpartum one as well. So it's kind of 12 weeks, or I like to call them levels because everyone's postpartum journey is a little different. Technically, you can start the program right away. In your first week, it's just very gentle movement, like gentle stretching and breathing. And then eventually progressing you back to strength training. But I like to call them levels because sometimes people take they start at 4 weeks postpartum, or maybe they start at, 16 weeks postpartum because that's when they were able to actually take time for themselves. Earlier is always going to be better for you. But I do like to call them levels, but it's kind of like bridging the gap between rehab and fitness because 6 week clearance is not enough.
Okay. And where can someone learn more about your programs and about you?
Yeah, the best place is always going to be on my website, drmayhughes.com. I've got a free blog with so much educational information. All of my programs are on there. I have a labor and delivery course and a weekly membership as well, that people can look at. And then, all of the free information and content that's on my Instagram as well, just Dr. Mae Hughes. Um, I try and provide as much education as possible because I am so acutely aware of the lack of access to pelvic floor physical therapists, especially in the US. And so it's always been my mission to provide as much information to women as possible because we deserve it. We deserve it for having babies. We deserve to have this information. So yeah, website, Instagram, that's going to be where I'm the most active.
Amazing. And we'll put all of those links in the show notes below. Thank you so much, Dr. Mae, for your time and expertise. It's been so great learning more and being able to share this with our listeners. So I really appreciate it.
Yeah, thank you so much for having me, Lauren.
Thank you.